Today's webinar, thanks, Blair, is designed to share with our state agencies and higher education institution employers some information that's going to be helpful for you for the Go Live launch of Benefits 24/7. But we would like to say right up front that this is not a training webinar on how to use Benefits 24/7. However, we will be sharing some resources at the end of the webinar that are going to point you to how to learn the different functionalities of the system. So before I go ahead and get started, my name is Debbie Crumples, and I am here today with my teammate, Larry Cade.
How you doing?
Okay, so here's what we plan to cover today. So we're going to go over some reminders on getting logged into the Benefits 24/7 system. We're going to cover how to access different employers for BAs who have access to more than one employer. We're going to give you some things to do before our go live date, as well as some things to review and do on the actual go live date and then after the go live date. We're going to cover some other information that's going to be helpful to you as a BA. We'll give you some resources that can help you and your employees should any of you run into issues that are related to Benefits 24/7 once we do go live. And this will include a section on troubleshooting login issues for your employees. And then finally, we'll open it up to the questions that have not been answered throughout the webinar, as long as we have time within the allotted time of the webinar. Okay, so it is real this time. Benefits 24/7 will go live on January the 16th. And because Benefits 24/7 will be replacing PEBB My Account, your employees will no longer be able to access their PEBB My Account. So beginning January 16th, when your employees go out to the PEBB employee website, it's going to be the Benefits 24/7 logo that's now going to show up where they're used to seeing the PEBB My Account button. And for you as BAs, for the ones who do key into or have access to the Pay One system, which is going to be most of you in our audience today, then the last day that you're going to have access to the Pay One system is going to be Friday, January the 12th until 6 o'clock p.m. And because Benefits 24/7 isn't going to go live until January 16th, that does mean that there's going to be a temporary pause in your ability to do benefits administration functions. However, just know that your employees' benefits will continue without any interruption. And because that's because they won't be making any new benefit elections. So their current elections and enrollments will just transition to the Benefits 24/7 application.
Hey, Deb,
And if you, yeah,
they're asking if you can increase your volume just a little bit.
oh, okay. I think that I have it up on high. So just a second, let me see what I can do. It could be I'm not talking as loud as I normally do because I'm not feeling so great today. Um, okay, I'll try to speak louder too. Okay. So if you are wondering what happens to Pay One after January 16th, just know that it will continue to be a part of the insurance system because the data that we maintain in Pay One is what we use for billing purposes, and it's also where we get the information to send to the different insurance carriers so that they have accurate enrollment and address information for your employees and their enrolled dependents. However, it's only going to be HCA staff that will have access to Pay One once Benefits 24/7 live, because everything that you're going to need as a BA is now going to be in Benefits 24/7. Just one second, I have an alarm going off. Okay, so just remember that when you or your employees make changes in the Benefits 24/7 application, then those changes will update to the Pay One system, and then that's how the Pay One system is going to stay current. Okay, so now I'm going to go over some reminders about getting logged into Benefits 24/7 as a benefits administrator. So first, like we shared in the training videos, Chrome is going to be the preferred web browser when you're logging in. And then here's the link to the live Benefits 24/7 login page. But just keep in mind that the link is not going to work until the actual go live date. So like your employees, when you're on the PEBB BA website, and if you are a BA who currently has access into Pay One, then you're going to be used to accessing PEB My Account either at the bottom of the main BA webpage by clicking on the PEB My Account icon that's in that blue navigation bar, or you use the green PEB My Account button. But once the system does go live on January 16th, then all of you, so that does include all of our BAs, whether you have access into Pay One or not, will see the Benefits 24/7 logo in the same places that you're used to seeing the PEB My Account icons now. And most of our state agency BAs will be accessing the application through the bottom button that's on the main Benefits 24/7 login screen, which is then going to take you directly into the Benefits 24/7 application. However, we do know that some of our state agency BAs, as well as the higher ed BAs, will be accessing the application through the top button, which is then going to take you out to the SAW page for some security authentication, like additional security. So just remember that for those of you who are logging in through the bottom button, the SAW page will be a live SAW environment. Or maybe that's the top button. I'm sorry, the top button, right? It's going to be a live SAW environment. So if you already have a SAW account that is attached to your work email, you can use that login information to sign in. But here's something that we do want you to be aware of. So if you created a SAW account in Benefits 24/7 in the training environment where you used your work email, then once you're in the live Benefits 24/7 application, this is also going to take you to the live SAW environment. And the SAW sign-in information that you used when you were signing into the training environment is only going to work if it's the same sign-in information that you also had set up in your for your live work email SAW account. So I know that does get a little bit confusing, but we just want to make sure that you don't have any issues with that because it's no longer going to be a test SAW environment. And if you don't have a live SAW account with your work email, then just like the training environment, you're going to need to sign up for a live SAW account and just be sure you use your work email. And that's going to be the one that you provided to us to get access into the live benefits 24/7 environment. Because remember, the email that was provided to us is what we have in Benefits 24/7, and your SAW account email must perfectly match the email that we put in Benefits 24/7 in order for you to access all of the features that you're going to need as your employer's benefits administrator. Also, if you do need to create a SAW account with your work email, please be sure that you're creating that live SAW accounts once you are logged into the Benefits 24/7 login, because this is where we do get a lot of confusion and questions. Because when people try to log into SAW and they get this error message saying that the SAW system is not recognizing their login information, then what they do is they go out to the statewide SAW webpage that's completely separate from the Benefits 24/7 site, and they sign in using their SAW account login information. And then what they try to do is add Benefits 24/7 as a service under their SAW account. So that's kind of where they get frustrated because they can't find us as an option to add as a service. And that's because that is not how to do it. So if this does happen to you, just know that that error message that you're getting is just telling you that you need to go ahead and sign up for a SAW account with your work email once you're logged into the Benefits 24/7 from the Benefits 24/7 login page. And also, there could be one other reason that you might get an error message when you're trying to log into the live SAW environment within Benefits 24/7. And that would be if you're not using the correct username or password that is associated with your SAW account that is attached to your work email. So if that ends up being the case, you can troubleshoot that by just clicking on the forgot username or forgot password or both if that applies to you. And then the SAW system will send you an email reminding you what your username is or a link to reset your password. And we have received a lot of questions asking us if the Benefits 24/7 training environment is still going to be available to you after the go live date so that you can use that for testing and training purposes. And we would like you to know that for now, the answer to that question is yes, it will continue to be available. Okay, so in this next section, I'm going to go ahead and cover how to access multiple employers for any of our benefits administrators who have been assigned a BA role to more than one employer. So here is a screenshot of a BA dashboard once you're logged into the Benefits 24/7 system. And as you can see, this BA is logged into the Department of Ecology. And here's where the BA who has multiple employer access selected this specific employer. All they did was click on that drop-down box. But let's say the BA needs to work with a different employer, then all they're going to do is click the drop down box, and all of the employers that they have access to as a BA are going to come up. So in this example, let's say that the BA wants to work with South Puget Sound Community College, then all they would have to do is click on that employer from the drop down box. And then here's what their BA dashboard is going to look like. So as you can see, the BA would now be logged on to the South Puget Sound Community College. And that's how, if you are someone who has more responsibility for more than one employer, that you can toggle between those different employers so that you're not having to log in and out of the system multiple times. Okay, so on these next couple of slides, I'm just going to give you some guidance on what we would really highly encourage you to do prior to the go live date of January 16th. So if you have not already done so, we need you to please submit to HCA anyone that you know should have BA access to the Benefits 24/7 live environment. So we do know that a lot of you have already done this, so we just like to say thank you for that. But there are still some employers who have not submitted any BA access for once the system does go live. So to make these BA access requests, whoever your security authorized person is at your organization, all that they need to do is sign into the HCA support portal. And then once they've logged in, all they need to do is make a request. And then here's the screen that's going to come up for them. So most of you are already familiar with this portal, but I'm not sure who your security authorizer is. If they're not, then hopefully you can guide them through the process. So all they really need to do is click on the public and school benefits administrators only, just like you guys do. And then this screen will come up and they can select that benefits 24/7 security designation option. And then here's the screen that's going to come up next. So as you can see, I have already entered some of the information so I can better explain it to you. So in the first box, the security designee is going to click on PEBB from the drop-down box. And then they're going to select their organization, again, from the drop-down box. And then the HCA code is going to automatically populate based on the organization that they selected. But just know that if you can't find your organization for whatever reason, like maybe we don't have it listed the way that you think it should be, then you can always go down to that HCA code box and type in your code, and then the system will automatically populate your organization's name the way that we do have it listed in the system. Then they just need to click on the add option to add the BA's information so that we can get them added to benefits 24/7 before the go live date. And then once they're in that add feature, as you can see, the system would just be asking for the BA's name, their work email, and the level of access that they would be authorized for. And in this case, the example just shows that it's me and giving myself the admin access. Then when they click on that submit, that is how it's going to get to us so that we can get it entered. Also, your security designee is going to be able to add BAs in this option before we go live for the edit or read access. So then, if they don't want to wait until the after go live date to put this stuff in, if you guys want to submit that to us now, we're happy to put people in for the edit and read access. And then again, until you receive further notice from us, just keep in mind that this will continue to be the way that your security designee can request admin level access for any other BAs once we do go live, because it is only HCA that can grant that admin level access. Okay, so we would like to say this. Let's say you sent us a request to add a BA with admin access, but that employee has either left your organization or they are no longer in a BA role. Because I know we did ask for this information quite a while ago, and then the launch got put off, and then we've had a lot of changes in employees since then. So what we'd like you to do before the go live date is please send us a request again through this same process that you asked us to add them, and which is through that benefits 24/7 security designation feature. And just like the screen where you asked us to add a BA's access, you're going to tell us that you're a PEB employer and you're going to select your organization again from the drop down box. And then you're going to click on the option to add a benefits administrator. So I know this sounds really weird because it is. The language does not seem to make sense. And I asked this question, and this is what I was told is how it is today to do this. So I'm going to walk you through it, even though logically it doesn't make sense. But on the next slide, I'll show you why you need to do it this way. Okay, so here's the screen that's going to come up next. And this is where you can give us the BA's name that you need us to remove, as well as their email address that you previously sent us and that we have entered into benefits 24/7. And then on this remove, click remove under the add or remove section. And then you're going to click add, which in this case is really telling us to remove the BA. And so again, I do know the language seems kind of weird, but that is the process to go ahead and have us remove any BAs that have that admin access. Okay, so now I'm going to move on to some information about once we do go live on January 16th. So the first thing that we are going to have, well, the first thing you're going to be doing, I know I'll be doing it as well, and Larry will be too, is on the go live date is log in to Benefits 24/7. We got to make sure you can get into the live environment. So if you can get logged in, that is great because that is what's supposed to happen, and we do hope that it does. But we are anticipating that some of you might run into some problems. So we wanted to give you some suggestions on how to troubleshoot this. So first question is, are you logging in using the correct login button from the main Benefits 24/7 login screen? Because remember, it is state agency BAs are going to be the only ones who can use the bottom button to log in. And then all of our other BAs are going to need to use that top button to log in. So this applies to any state agency BA who's not able to access benefits 24/7 through the bottom button. So just keep that in mind. Then if you are using the correct button and you still can't get logged in, then the second question, and remember this won't apply to most state agency BAs, is are you using your SAW account that is registered with your work email address? So again, this is really important because if you're using a SAW account that's registered with any other email address that you already have a SAW account for, then Benefits 24/7 is not going to recognize it because the email that we use to set you up in Benefits 24/7 has to perfectly match the email that you used to register that SAW account. So if you don't already have a SAW account that's registered with your work email, then all you have to do once once you get to the SAW page is sign up for a SAW account and be sure you use your work email address, which we covered already a few slides back. And then just know that you have to be logging in from the Benefits 24/7 login page when it takes you to this SAW page. It has to be within the application for Benefits 24/7. So once you know that you're logging in using your correct SAW account that is registered with your work email and you're still not able to get logged in, then we suggest that you go ahead and check with whoever your security designee is to see if they actually submitted your name and email to us to have you added as to the system as a BA with access. And here's what we'd like to say. If you don't know who your security designee is, then yes, please go ahead and send us an HCA support ticket. Let us know that you need to know who that person is. We will identify them and then we will get that information back to you so that you can work with them to get yourself added to the system. And here's another thing that we'd really like you to do on the go live date is to go out to your manage access tile and check to be sure that the BAs that you did submit to us are there and that their work emails are correct and that the level of their authorized access is correct as well. So here's something super important to remember that any BAs who were added to the training environment are not automatically going to come over as authorized BAs in the live environment. So it is really important to be sure that the employees that you want added are listed here. And if there are any BAs who are missing who need that admin access, then the security designee can submit that HCA support ticket through the Benefits 24/7 security designation option to have us go ahead and add them. If you have any BAs who are missing who need edit or read access, then the BA who has admin access can go ahead and add these people from this tile and assign their access level. Also know that BAs with admin access can also remove BAs who are signed with edit or read access, as well as remove any of your inactive BAs down the road. However, if there are BAs, again, with admin access who are listed on the tile who are no longer employed by you or no longer in a BA role, please go ahead and submit that request like I explained earlier through the Benefits 24/7 security designation to have us go ahead and remove them because you will not be able to remove anybody with admin access. Only HCA can do that. Another thing that we'd like for you to do on the go live date is to enter your employer contact information under your organization profile tile because there is going to be no information already there once we go live. So basically what this means is that any contacts that you entered into the training environment, like I did here for this test contact, will not automatically come over to the live environment. So once you are in your live system, in the live system, under this profile tab or tile, you can scroll down to the bottom of the page, and that's where you're going to be able to add your contact like I have here. And then when you do add your employer contacts in the live environment, please just keep in mind that these contacts might be different than who your BAs are. And that is absolutely okay because sometimes a BA is not going to do these roles that are listed on this screen. You might have other people who are designated to be managing this. So when you do add them, not only will you want to choose which one of these functions they will be a contact for, but please make sure that you include their name, work email, and their phone number. Because really, this part of the application is mainly for HCA to use because we're going to use it to quickly identify who we should contact for these various benefits issues. Okay, so in the next section is where I'm going to cover some things as they relate to after the go live date. Not necessarily the day after, but after in general. So first, we do want to encourage you to figure out um, how often you should be logging into the Benefits 24/7 application. So I like to say, figure out what's good for you, like some kind of regular frequency though. And only you're going to really be able to define how often you need to be in it. But because our state agencies and higher ed BAs, you guys deal with a large number of employees on a really regular basis. So I guess I would highly just recommend that you log into Benefits 24/7 on a regular basis of daily, right? Get in there every day, log in, see what's going on. Because once we go live, your employees potentially could be adding dependents to their coverage. We have heard from a lot of BAs that they may not be telling their employees to use the benefits 24/7 from the employee or subscriber side, but your employees are still going to have access to it. So they might get in there and use it even if you don't really want them to. So the only way you're going to know that is to be logging in to see any activity out on these tiles. So you'll want to be checking the dependent verification tile, as well as the special open enrollment event verification tile. Because as you know, this is where you're going to be able to quickly identify if you have any of those outstanding verifications for you to review and approve. Because you don't want anybody who's adding dependents or processing an SOE to like not get verified timely so that their stuff can happen and their enrollments and coverage will take place the way they're supposed to. Okay, so here's some other important information that will be helpful to you as you begin working with benefits 24/7 in the live environment. So I'm not sure if we have any BAs with us today from the UW or Wazoo, but if we do, just know that your employees will have limited access in the Benefits 24/7 application. And that's because your employees make their benefits elections and changes using the Workday application. But they will have access to two of the tiles if they log into Benefits 24/7. So you just need to know that the first one they're going to be able to have access to is to enroll in the PEBB retiree insurance program. And they're also going to be able to enroll in PEBB continuation coverage, which would include coverage during an approved unpaid leave of absence or COBRA. But everything else will still go through Workday for these employees. And here is something else to keep in mind that even though Benefits 24/7 is a new system, the PEB rules and policies have not changed. So that just means that your newly eligible employees are still going to have to make their benefit elections within their 31-day eligibility window. So just keep in mind that the sooner you get these newly eligible employees added to benefits 24/7, then that's going to allow them to use the online enrollment system for the fullest amount of those 31 days. Also, employees must still submit their SOE changes within 60 days of the date of the qualifying event. And then when your employees are adding dependents to their coverage, dependent verification is still always required. But now your employees can upload their dependent verification documents as well as proof of their special open enrollment event when they're using the Benefits 24/7 employee account. Just know though that they do not have to upload them. They can still provide hard copies to you like they have in the past. The current PEB billing processes will not be changing either due to the rollout of Benefits 24/7. So just know that we have gone ahead and updated the accounting manuals that are located on the PEBBA website so that they do now include how the information that you enter into Benefits 24/7 is going to impact your billings and when. And you can find the manuals out at the link that is at the bottom of this slide. And then here are a few other things that we just want to make sure that you're aware of. So there will be some changes to the eligibility worksheets. So first, just know that there really will be no changes from a rules perspective, and that's because there really aren't any rule changes. Benefits 24/7 does not change those rules or policies. However, there will be some language updates. So the first one is going to be that where you are used to seeing the word pay one, you're now going to see the words benefits 24/7. So that's also going to apply to any of the manuals that we have out on the PEBBA website. And then any guidance on those worksheets for your employees will now have language referring to benefits 24/7 in addition to paper open, or I'm sorry, not open, paper enrollment change forms, which really is not new for your employees. Because, I mean, as you know, and again, I'm not sure how all of you are planning to handle it, but with the rollout of benefits 24/7, your employees will be able to make their elections and changes online. And they will still be able to use paper forms. Also know that the changes that are being made to these worksheets has already been made because we have so much and we have had so much work to do with the rollout of benefits 24/7 that we went ahead and updated the worksheets as of January 1. So between now and the go live date, if you go to use one of the worksheets and you see this, just do the processes the way that you do them now with Pay One, and just know that this will benefit you beginning January the 16th with this new updated language. And then again, for most of you in our audience today, you won't really need to worry about this because you use HRMS to keep your employees' salary information updated. And then that automatically keeps the salary information and benefits 24/7 updated. But if you do not use HRMS, then just remember that you're going to have to be sure to update your employees' salary information in benefits 24/7 manually at any time that your employee salaries change throughout the year. Because as you know, this is the amount or this number, their salary, is what is used to determine what the premium for their employee paid long-term disability will be. And if you are a benefits administrator from one of our higher ed institutions, then you really don't need to worry about this at all because you won't be using benefits 24/7 for your employee long-term disability elections or premiums. Okay, so before we go ahead and open it up to your questions, I would like to provide, or we would like to provide you with some resources when you do run into issues and need some help with benefits 24/7. So again, for you as BAs, you can send us your questions through the HCA support portal. Again, you select that public and school BAs only option, and then you click on the BA inquiry option. And we know that most of you, you're already familiar with sending us in these support tickets, but there is something new that we wanted to bring to your attention when you do this. So that's going to be that after you tell us you're a PEB employer, the system is now going to ask if your inquiry is related to the benefits 24/7 online enrollment system. So if you click yes on that question, then it's going to offer you a drop down menu to tell us more specifically what your inquiry relates to. So the four that are out there to choose from are, is it a login issue? Are you trying to report a technical issue? Are you trying to provide us with some suggestions or feedback? Or do you want to submit a request for training? And if you say no, that your inquiry is not related to benefits 24/7, then no worries because then it's just going to allow you to choose from the options that you're used to seeing now, minus the benefits 24/7 option. And if you are submitting a request for training, then please be sure to provide us with some specifics about what training you're going to need in the details box. And this would include giving us some date and time options that we can choose from so that we can get your training set up for you. And just know that we are happy to provide training in person or virtually based on your needs. So just be sure to let us know what your preference is again in the details box. Also for benefits administrators, there is some information on administering PEB benefits in Benefits 24/7, and this is posted on the PEBBA website under the Administrative Tools and Resources section. For emergent issues, you can always contact our outreach and training team at this 1-800 number that's listed here on the slide. But we do want to say that please try and keep in mind that if everyone calls our number for assistance with things that are kind of non-emergent, then we are really going to struggle to be able to get to the emergent issues right away. So, we haven't truly defined that, but just kind of be aware emergent, if it has to be done right now, then we can, we'll try to get to that. But the rest of them, we're asking you to please submit those through the HCA support portal. So also on our BA website, there are manuals and resources for the benefits 24/7 system. And these are posted in two places. So you'll be able to find them on the forms and publications page, as well as the admin tools and resources page. And you can always go back to the benefits 24/7 instructional videos that we do have listed under the training resources and then under training materials and recordings. And then finally, please be sure that you are registered for gut delivery because if you are not already, then you're going to miss out on the information that we send you as we have notices and updates that will continue to be rolling out after the go live date for the benefits 24/7 system. And finally, we will be hosting a post-launch webinar on Tuesday, January the 30th from 10 to 11:30. And this is where we are going to address topics that we receive multiple questions about once the system has gone live and as it relates to Benefits 24/7. So if you run into any issues with Benefits 24/7, we need you to please be sure to send a ticket through the portal because this is how we're going to get information um, to be using it for the post-launch webinar. However, just keep in mind that we aren't going to be waiting until January 30th to try to come up with any fixes or corrections because we will be doing those as we get your tickets. It's just that we will also be taking the ones that are higher profile or that we're getting multiple issues reported to us that we also want to go ahead and share in this post-launch webinar so that we can share the information with everyone. But again, you'll want to be registered with the Gov Delivery because as we fix and correct things that you are finding, we will be letting the other BAs know as well through that Gov Delivery messaging system. And if you have not already signed up for this webinar, we just, there's our link at the bottom of the slide to go ahead and do that. We encourage you to do that actually. Okay, so for your employees, when they need help with benefits 24/7, because we are already getting a lot of questions about this, so here's some resources that you can help them with. So just first, refer them out to the PEB employee website where they're going to be able to click on public employees. And then under that section of the website, they're going to be able to find more help with and information about benefits 24/7. Also, in the four-year benefit newsletter that was sent to your employees, it's been a while now, last May, we did introduce your employees to benefits 24/7, and we provided them some guidance on how to set up their personal account, as well as provided them with some links to these additional resources above on this slide. And we are planning to provide similar information once again in the February for your benefits newsletter. So that's just right around the corner. And then back in June last year, we did send a quick start guide to your employees, again, providing some more easy to read information about getting started in benefits 24/7. And that's probably been pushed to the side now by many people, but we will be doing that again once the benefits 24/7 system is launched on the 16th of January. And this next one is for your employees and for you as BAs that the enrollment guides are updated and they do reflect information about benefits 24/7. So if you have not already ordered these, you can go ahead and do that if you would like some of them in hard copy format to be providing to your newly eligible employees. And I did take a look at it. It's great. It's got a lot of really good information, especially for your newly eligible folks, that if they use that and you kind of direct them to that, telling them that information's in the guide, it's really nice and it's going to help them, get logged in, hopefully without having to come back to you for too much assistance. And then finally, you will be their main point of contact if some of these resources don't work for them, right? Because they don't have any way to reach out to us really. So if you cannot answer their question, then we ask you just to please reach out to us through the HCA support portal. We will help you come up with the answer and then you can share that with your employees. Okay, inevitably, you are going to at some point, whether you're trying to hold back the floodgates for your employees or not, but you will run into problems with your employees at some time trying to get into benefits 24/7 as an employee or a subscriber. So we did want to make sure to give you some troubleshooting resources that will help you should they be coming to you for assistance. Okay, so first, your employees or subscribers are going to need a SAW account to access their personal Benefits 24/7 account. So if they already have a SAW account with their personal email, then they can certainly log in using that SAW sign-in information. Um, no worries, right? But if they don't have a SAW account with their personal email, then they can sign up for a SAW account and then just be sure to tell them to use their personal email address when they're signing up for that. So like I covered earlier, They just need to be signing up for their SAW account once they've logged into the Benefits 24/7 application. So not from the statewide SAW website. Also, for our BAs, just be aware that some of you might have two SAW sign-ins. So one will be registered with your work email for access into Benefits 24/7 as a BA to do BA functions. So that's if you're one of the BAs who's using that top button to log into Benefits 24/7. And then you would need one for with your personal email so that when the time comes and you need to make changes to your own benefit elections, you can do so as an employee or subscriber. And for the majority of your employees, this process that I've covered should get them into the Benefits 24/7 application, and then all would be good to go. However, we do know that there could be other issues, so that's why I'm going to address these next few slides. So let's say your employees have done their SAW sign in, they're using a personal email, they're doing it within the Benefits 24/7 login that took them out to SAW, and it's still not working. So here's another thing that you could do. You could instruct them to clear their browsing history. So how they can do that is to hold down the Control Shift Delete buttons simultaneously when they're using their Google Chrome. Then this would open their clear browsing data window where they can select the all-time option from the time range drop-down menu. And then they could click on the clear data option that's at the bottom of that window. But let's say you have an employee who's just forgotten their SAW username. Well, then all they have to do once they've clicked on their login button from the main Benefits 24/7 login page, where the system is going to automatically redirect them to the SAW webpage, is to click on the Forgot Your Username option. And then that's where they're going to be able to enter their email address. And then the SAW system is going to send them an email with their username that is associated with their SAW account. And if you have an employee who's forgotten their SAW password, then all they have to do once they've clicked on the login button from the main Benefits 24/7 login page, where again they're going to be automatically redirected to the SAW web page, is to go ahead and enter their username here and then click on the option for the Forgot Your Password. And then the system is going to allow the employee to enter their email address that's associated with their SAW account. And then the SAW system will email them some password reset instructions for their SAW account. Here is another item that you can do as a BA, and that is to be sure that your employee's information has been entered correctly in Benefits 24/7 to begin with. So this just means that you'll want to be sure that you've entered their last name, their birth date, and their social security number correctly. And this also includes being sure that the employee's first and last name is not entered in the system with any spaces before or after their name. So just remember, this is really important because when your employees are trying to log in, this is the data that they're going to be using to get logged in to their own Benefits 24/7 account. And if any of this information is not correct in Benefits 24/7, then Benefits 24/7 isn't going to recognize them, and therefore they will not be able to get into the system. So just keep in mind that your employees who will be transferring over or migrating, maybe that's a better term, migrating over into Benefits 24/7 on the go live date, this probably really won't be an issue. However, it could be an issue for any newly eligible employees that you enter in the future and potentially run into this login problem. There could also be times when your employees try to log into the system and they'll be prompted to answer their security questions. So just know that this is only going to happen if your employee logs into Benefits 24/7 using one SAW account, and then later, say like during open enrollment, they try to log in using a different SAW account because as we all know, that SAW does allow people to register with more than one SAW account, and many, many times people forget their their whichever one they're using, right? And they just use whichever one comes to mind. So when they do this, they use one time, and then the next time they use a different one, then Benefits 24/7 is going to recognize that they're not using the same SAW account that they used to log in when they first logged into the Benefits 24/7 system. So when that happens, the system say, hey, basically prompt the employee to answer those security questions because it's saying, we want to make sure you are who you say you are. And then if they answer those questions and they don't line up, that's when the system says, we don't like that. We're going to lock you out because we don't think you are who you say you are. So then this is when they're going to need some help with getting logged into Benefits 24/7, and you can help them as a BA. So basically, you would go out to the application, you would search for that employee, you would click next to their name and then manage their account. And then that's when you can click here on this option that will show up above the various tabs to go ahead and release or unlock the subscriber's account. And this would allow your employees to go back into their Benefits 24/7 and go ahead and select new security questions for their account. So I think those are pretty comprehensive, but just know that all of this troubleshooting information, we kind of wanted to show it in visuals, but it is also covered in the PEB Benefits 24/7 manual, chapter 2, that's on the PEBBA website. Okay, so that covers what we wanted to share with you in getting ready to go live with Benefits 24/7 on the 16th. So now I'm going to open it up to Larry, see where we are with your questions. I see we have a whole bunch kind of hanging out there. So see how we can answer them maybe live or see where we're at with them. So how are we doing, Larry?
Well, Deb, you probably want to start at the top because some of that stuff is, I don't know. You might want to start at the
Okay,
top
no
there.
worries. What time is it? So we're here till 2:30. I think 1 to 2:30. Yes. So we have plenty of time to see if we can um and I apologize about the voice thing again. Was just not feeling so up to snuff today. Okay. I'm just gonna take them at the top. Yep, volume thing. No worries. I'll just get rid of that one. Do you have, I'm gonna read them. Are you good with that, Larry? I'm gonna read them and then
Yeah,
try
go
to
ahead.
answer them the best I can. Okay. Do you have a communication we can send out informing employees my account is being replaced with Benefits 24/7? We are doing that. So like I said, employees have already received stuff. Maybe they have read it, maybe they haven't, but more information will be going out again in the February newsletter, as well as we're going to do another uh, one more time sending something to their home for the quick start thing. As far as, again, I'd like to say we have a lot of BAs saying they are not really encouraging their employees to use it. So depending on where you're at and what you're going to be doing with that will be your call. So, unless you have employees that you are instructing, hopefully you won't run into that anytime quickly, and our communications will get out to them before they have a whole bunch of questions. Will agencies have access to A23? If not, what is replacing that? Larry, what is A23?
It's an insurance screen, but I don't have access to myself, so I don't know exactly what that does. But I'm sure some of the reports that we have through Benefits 24/7 will probably address those issues, but I do not know the answer to that question.
Okay, so here's what I've been told. Um, Pay one, no one will have access to that. No BAs will have access to that any longer after they shut it down on the 12th at 6 o'clock p.m. If you need anything that Benefits 24/7 is not able to provide for you, we would ask that you please contact us through that HCA support portal, give us a ticket, and we certainly have folks on our side. Larry's going to be one of them, just trying to find out information or how to help you find it in the Benefits 24/7 system. Is HCA doing data validation to make sure accounts cross over correctly from Pay 1 to 24/7? Yes, they have. I am not exactly sure how they're doing that because we're not on the development team, but absolutely they've been doing that for the months since the last time we postponed the launch. So I will say this, and I think Larry would support me on this, that we know we are going to probably run into some issues. When you have a data migration going into effect, there's going to be a large percent that comes over great. We may run into problems, and we have a team that will be ready and available to hit those things as quickly as we can. So, with any migration, I think, to some degree, we have to expect that. But as you find those, we need to know about them so we can help get them fixed, okay? Will you have to create one related to your work email? Right now, I have a SAW account tied to my personal email. If you are a BA who is logging into Benefits 24/7 using that top button because you are either not a state agency or your state agency doesn't use WATEC, um, then yes, you will need to have a SAW account attached to your work email because it's that work email that kind of attaches you to your work email that we signed you up for access and Benefits 24/7. And if those two emails do not line up perfectly, it will not let you into Benefits 24/7 to perform those benefits administrator functions. Okay, what if you have your work email, personal email linked to SAW? That's okay. Just know which one is which though, because your personal email is the one that you're going to be using when you're accessing it as an employee or subscriber, right? Because all of our BAs, most of them have benefits enrollment as well. And one day you might need to be making changes or open enrollment. One day down the road, you might not need it to, when on go live date, but you might need it later. And that's when you're going to want to use your personal email. But if you're one of those BAs who's going to be accessing benefits 24/7 to do BA functions using that top button, yes, you will need a work email SAW account. So yes, you could possibly have to. What is the benefits 24/7 login page located? Oh,
She found
where?
it. She
Okay.
found it. She
Okay,
found it.
good. Great. Okay, thank you. Yeah, if I'm duplicating, just let me know. Used personal email for SAW and my account. Will that work? Um, if you're doing it for a subscriber account, yes. If you're wanting to use it for your personal employee subscriber benefits information, personal email will not work for BA functions. Has to be the email you sent us that we entered into Benefits 24/7 to give you BA access. Did you say if already registered, but if you also created a software training, use the training login for the live or still use the current Pay One login? Okay, so here's where we get confusion, and I just wanted to say it because I knew we would get questions. So when people were, going into the training environment for Benefits 24/7 and logging in using that top login, even if you had a SAW account that was attached to your work email, it was not recognizing it because that was a pretend SAW environment, right? For Benefits 24/7. So people could test. So we said, go ahead and sign up, use whatever you want, use your real one if you want, because it's just in the testing environment. So if that is your work um, credentials for the live SAW environment for your username and password that you were using and had set up in that pretend environment, by all means use it again in the live environment. It won't matter. It's only if you don't have one with a work email that you need to set one up. Will access requests that we submit for the training environment automatically be applied to the live environment? No, 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 no. If you have access to the test environment, do you still need to request BA access for live? Yes, through your security designee. BAs for our agency will need access to 3 different organization groups. No worries. Make sure we get that information, what you need added and which employer that you want them added to, and we will make sure that they are set up in the system before the go live date. Can we wait until it goes live? I've added most folks, but we have hired many since. I would like to wait until the go live date to complete adding and ensuring folks have the employers they are supposed to. That's fine, however you want to do it. Just know that they may not have access on the go live date. That will be your call. Again, your admin BAs on go live date will be able to add any BAs that you have to edit, give them edit or read access. But if you would like them to have admin access, you might as well submit those now because we are the only ones who can put that in for you. So, you know, let us have that information for you now so we can get that set up. Otherwise, you're going to be submitting it later. Is there a way to find out if our security designee has added our users? Yeah, you certainly could. Well, do you know who your security designee is? If you do, ask them. Ask them first. If you don't know who they are, send us a message. We will let you know. Or on the go live date, try to log in. If you can't, or those people who are supposed to have access can't log in, then you can do it on the backside. So whichever way you want to do it, you can do it before or after. Can we add after 116? Absolutely. Just like I explained. Do we need to resubmit our access requests if they are still out there pending? Hmm. I don't know what pending means because here's the thing. You won't know if they're added. Only we will. And hopefully, based on what our team is telling us, they have been adding those people to the live environment. You won't know if they're added until the benefits system on the 16th. Once it goes live, you'll have to check that manage access tile or have your people try to log in. Will Chrome be preferred browser for new employees when they access their accounts and select coverage? Yes, and it's only preferred, right? So if it's, it'll work on the other ones. And I have to be honest, I do not know where the hangups are if they use like a different browser to get in. It's just my understanding that this is the preferred. And Larry, do you know why it's considered preferred? I'm not that techie.
No, I do not.
Yeah, sorry, can't answer that one. Is it possible for us to get a list of existing BA accesses for our agencies? Um, that you submitted for the live environment is what I'm assuming you mean. And I would say possibly. I would send in a ticket for that. We can answer that yes or no, but it won't be me and Larry. It'll be another team that's doing that. Did you just say we can't log into the 16th? Correct. Cannot, even Larry and I cannot get into the live environment until the 16th. So there's a lot of things we want to see. We want to see how they work, but we still can't get in. We're still working in the training environment. So I have all my PEB and SAW info in my personal email. Okay, well, that'll be fine. Your personal email SAW account will get you into your employee subscriber side. Again, as a BA, you will need one with your work email. So you might have a couple of SAW accounts. Found it. Good. I love that one. Sorry, I'm super sorry that my voice was low. I feel like I'm screaming right now. Um, can you leave benefits 24/7 open and just refresh? That's a good question. I keep it open in the training environment a lot, and it seems to be fine. Here's what I would say. Test it. See once we go live. So to confirm, there's no way to prohibit access for general employees to make enrollments and changes. Okay, so people who are coming over, migrating from Pay 1 to Benefits 24/7, those three things that they need to log in are going to be their last name, their birth date, last four of their social security number. That's all they need to log in to the employee side. Correct. And as long as they have got a SAW account set up and they're using it accurately, they'll be able to get in. Yes. Now, the only way to prohibit new employees, brand new ones coming on is, you wouldn't key them in yet. But once you key them in and they have eligibility all established on the date of their eligibility going forward, they can also get in and do enrollments. So just kind of keep that in mind. We can't close it off. That's a communication piece on your part.
Hey, Deb. I wonder if
Yeah,
Josh is talking about, hey, if I go in there and make a change, we have as an employer, you still have to approve it. So they just can't make changes and role depends and stuff without you approving it as a BA.
correct.
So I think that's what he's talking about, but
Okay,
I'm not 100%
absolutely.
sure.
That's when it's mid-year. You're right. Absolutely. Yep. And the same thing, like if it's a brand newly eligible employee, if they don't add dependents, they're just going to do it and it's over, it's done. And you aren't going to see anything because there's really nothing for you to have to see. They're just going to get enrolled based on their elections. And then, of course, you'll probably want to see what they enrolled in because of payroll and all that and invoicing. But there will be reports that you'll be able to see that should be able to let you know when they selected their benefits and what they selected. Where can we go to review employee enrollments that do not require DV docs or SOEs? How do we know they've completed the process? There will be on the reports tile. There will be an option where you're going to be able to select the benefit elections options and give it a date. So my supervisor and I were, because we just got access to it just recently where it was somewhat functional and it did produce a report that was kind of nice. So once you're in there and you're able to use the reports function, go in there and look at that and see if that's working for you. And, we might have to provide some additional information, but here's something else I want to say. Use those benefits 24/7 BA user manuals. There's a chapter 1, chapter 2, and chapter 3. And there's some stuff in there that I didn't even know was there until somebody brought it to my attention the other day because I didn't write them. And there's a lot of information out there. So please use those as a great resource because they really are. Is the system still set up that we will not get any kind of notifications that we have things that need taken care of? Correct. That's why I say you get to determine based on the volume of activity that you can anticipate with your employees, how much do you get from your employees when it comes to their benefits and making changes or new enrollments, right? New hires. So be in that system regularly. If it means every day, just like you log into your system to get onto your computer every day, just log into benefits 24/7 every day. See if you have anything out on the dependent verification tile. Do you have anything out on the SOE verification tile? Again, like I stated earlier, if you got new employees who are coming on mid-year, whatever, there's nothing you're going to have to do if they are not enrolling anybody because there's nothing you approve. If they don't enroll, it's going to automatically default on the 32nd day. So, and then you'll just find out what they enrolled in when you go to run those benefit election reports off of the report tile. Okay, are there any solutions being worked on for the manual entry of employee salary info? Thinking of our annual cost of living adjustment for over 130 employees and how much time that takes. At this time, it's my understanding that, so I'm assuming this is going to be for based on that question.
No,
It's
there's not anything
right.
out there
There's
right now.
not. And it's not going to be yeah, we apologize that if you don't use HRMS, and you're a state agency or somebody who just doesn't use HRMS, yeah, you're going to be keying those manually, just kind of like they do now in Pay One, right, Lair?
Correct.
Okay. Can you do training for all staff or only for BAs? So all staff means employees too, right? I mean, I guess that's what this person means, right, Lair?
Correct.
Okay, so here's what I say. I would like to, but I don't make that decision. Send that in through an HCA training request. I guess I could say this, and I know this is going to be recorded and it's okay. If it includes a BA, great. If you need us to do some staff training while we're there, maybe just include what you need and we will see what people, give us a permission to do. But I know that we are happy to do whatever we can. Are we still going to be able to use the A23 screen? I already talked about that. How do we access the information from A23-24 once Pay One is closed? Yes, Benefits 24/7 has some reporting capabilities, and you would contact us to figure out whatever comes off of 23 and 24, how to figure that out in Benefits 24/7, or we can certainly get information for you. Are subscribers allowed to only have a PO box for an address? If not, what rule states that a street address is required? Um, uh, you know,
Well,
go ahead, Larry.
so it has a mailing address spot, right? Just like Pay One does. If
Right.
you enter a PO box in the mailing address, the street home address, we do this right now with Pay One. Because
Okay.
sometimes he'll have confidential addresses where they can't give us because they don't want people to get a hold of them.
Right.
It goes straight to the PO box. So yes, they can do that, or they can just put it in the mailing address field of it.
Perfect. Thank you. If something's already keyed in Pay One, like a separation for insurance to end on January 31 this year, will that transfer over to 24/7 since would be impending? It's my understanding that that would be a correct statement. Yes, it should come over. So I would like to say this to some of our BAs. If you have any of those things like that, hopefully you don't have a whole boatload of them so that maybe you could have them, somewhere like on the 16th. That might be something you want to like do a little bit of an audit on, right? For some of your employees, make sure the stuff that's kind of hanging out there did come over, right? I mean, I guess that's what I would do if I was in that role, but yeah, it's my understanding that it is supposed to come over. How do we order enrollment guides? Off of the PEBB BA website under forms and publications. When you get to that page, there is a blue box in the center of the website. You click on this says order materials. You can give them your name, your organization, the address, how much you want of what, and they will mail it to you. For retirees to sign up for retiree coverage, can they submit this before the employer cancels their employee coverage? Wazoo does not use 24/7 for our employees. Yes, they can submit their application for retiree coverage before their employee coverage ends or after. So here's what happens, just so you know. Nothing is a guarantee on that. All it is a submittal. It doesn't say, oh, hi, you're enrolled now. It just says when they get the message and they go through all the questions and fill this out trying to enroll, it says, we have received your information. It's awaiting review. So, if they submit it beforehand and they're still an employee, we will be figuring that out based on the dates they gave us. So, yeah, they can submit that early. And we do encourage them to do that, even if it was a paper form, just so you know that. Do BA users need to set up a personal account to make own plans, or can they go in through their BA account? Yes, under your own personal, right? You would not want to be making elections for your benefits or anything. Well, Larry, let me take that back for 1 second. I guess BAs do process their own stuff, right?
Well, like you said, though, if they want to make changes on our own personal account, use your personal email to do that.
Yep.
If you
Yeah,
want to
that
make BA changes, go to your work email. Just keep it consistent.
that would be my recommendation too. Is benefits 24/7 going to be accessible for blind, low vision employees? That's an accessibility feature that is not in our section that we manage, but I do know that that HCA does have people that work on this for everything that's online. So I have to believe that that is a yes. Can an employee create their SAW account before their first day of work and select their coverage before then too? Okay, so this is a good question because we just got that from somebody else. If you get, people can first create a SAW account any old time they want to. Okay, so just be aware of that. Oh, I guess not within benefits 24/7. I guess they wouldn't be, but so you as a BA are the one inputting your employees who are newly eligible into benefits 24/7. So here's an example. Let's say you have an employee coming on their first day of work is February 10th. And you are so busy, you want to get them into the system on February 2nd. So you're keying these feverishly just to get their eligibility in, right? Well, your employees, when they go to sign into the employee side of that portal, they're going to be able to get in because you keyed them in, but they are not going to get that wizard to make newly eligible elections because their first day of work is not going to be until their date of eligibility. So they are not even going to be able to elect anything until their first day of work, which is their eligibility. So just know that they can, you can get them in and they can maybe look at that, but they can't really do anything in it. If employees have a space in their legal last name and that comes over from HRMS, will Benefits 24/7 handle that? Yes. Here's the thing. When I said spaces in their first or last name and those fields in Benefits 24/7, I just meant before or after like their last name, right? So you wouldn't want to put in a space. My last name is Crumples. So it wouldn't be entered as space Crumples or Crumples space. But maybe I have I don't know, Van Dyke or something, right? And it's a split word. That's okay because that's in the middle, right? We don't split names at the front or basically at the end. It's always in the middle. So that's the difference. It would be able to handle that. Is there an option for a preferred first name when signing up our new employees? I did not see that. Did you, Larry?
No, they
Preferred name?
they should be just using their legal name, just like in Pay One. There's not a place for that either.
Okay. We have been told that we have to have hard copies of enrollment paperwork in case an employee transfers to another college. If new hires are now using the system, how do we address forwarding hard copies when an employee transfers to another community college? Um, this is more of how to, Larry, do you have any comments on that?
Well, now the system of record is going to be benefits 24/7. Where in Pay One, you have to have an enrollment form to go to the other college to see when somebody signed up. Now benefits 24/7 will take place of that.
Yes, and that will actually be in their, so a transfer, when you pull in a transfer, um, just a minute. Yeah, so if the other college gets them as a transfer, because you've transferred them, like you said, they're leaving your college because they're a transfer, and the other college goes to put their social security number in and their eligibility date, the system's going to recognize that it's open for transfer, and it's going to go ahead and you can claim that person to transfer in. Their coverage is going to not, it's going to be the same. So when you go click on their current coverage for the transfer in college, it's going to show the same thing because there's no opportunity to make new elections. Also, the subscriber history is where you could also look to see what their enrollments were. So you don't really need that paper. The only time that this could potentially be an issue is if we have a college employee who is going to a state agency or an employer group who offers full benefits with us, which is including the LTD, right? Because our higher ed institutions, their employees do not make their long-term disability elections in benefits 24/7. So we were talking about that. So if I'm a state agency who's getting a community college, I would have to be reaching out to, um, and it's a transfer, I would have to be reaching out to the community college to find out what that person's LTD, employee LTD enrollment had been. So we haven't got that all documented somewhere, but do you have anything else to add to that, Larry? It's kind of confusing, but
It's no different than the current process.
okay, perfect.
I
Sometimes
mean,
I
whatever,
make things
yes,
harder.
yeah, whatever the current
Sorry.
process, what that is what they do nowadays.
Yeah, sorry. Okay, what is the difference between this and the 10 a.m. webinar tomorrow? Tomorrow is for our employer groups, and our employer groups do not have the, not all of our employer groups offer all of the benefits that we have, and probably a lot of it is the same in all actuality because benefits 24/7 does not even offer people the opportunity to enroll in a flexible spending account or DCAP or health savings account. So those are the things, the FSA and DCAP we don't offer to our employer group. So for the most part, they're kind of the same. So if you want to come into it tomorrow, you can. If you want to see it again. After we set up the eligibility screen, will it gap over to HRMS overnight with default plans before the employee completes the rest of their enrollment? I would say no on that, right, Larry? It doesn't default until day 32 if no elections are made.
Yeah, I don't know how that's going to work. I mean, like right now on pay one, if you roll somebody, it has default plans on there. So I don't know if they're going to hold that
Okay.
information or what they're going to do with that. So it'd be something
Okay.
we need to ask a question about.
Absolutely. Okay. Will the EOS billing and change reports application still valid? Can you answer any of that, Larry?
Yeah, so the EOS still going to be the same. Reports going to only be the same.
Thank you. Is the accounting screen where we make adjustments to clear issues?
Yeah,
Accounting screen.
we'll have to ask. That's the A23 screen. That's the one we're going
Oh,
to have to
okay.
ask
Thank
about.
you. I didn't. Okay. Going forward, will new hires enroll directly into benefits 24/7? They can, absolutely, if if you want them to and you direct them to do that. Otherwise, they can use paper forms or they could use either. Currently in pay one, we can see history. Will this also be available in benefits 24/7? Um, okay, yes, under the history tile, but it will not bring over the history of, like, let's say Larry, he's worked here a long time and he's had his enrollments for a long time. It will not bring over any of the history that was in pay one, but let's say Larry makes changes from January 16th until he retires. All of that now will be in history, but it will not bring over pay one history. You
And you
can
can't
get
you
that.
you can't trust history screens either. They're
Well,
you really can't trust those history
yeah,
screens in pay
thanks for
one.
that, Larry. And I will just say this, and working in benefits 24/7 on the history screen for a subscriber, sometimes you can't even piece the whole story together. You will probably have to work with some people from our organization. If you run into specifics that you need information, we'll be happy to help you. Okay, so when we're adding employees to the system, will we be able to go in immediately after entering their new hire into HRMS? and add the employee with just their name and social, or will we have to wait until the next day after 24/7 feeds from the gaps? Now, that's a good question. We haven't been able to test any of that because nothing from Pay One has come over into this testing environment because we can't
It's
put any live data.
it's going to be the next day. So just like you do for Pay One, once you enter an HRMS, it's going to feed overnight to benefits 24/7.
Perfect. Thanks, Larry. Where can I find the information? Is this employee represented and the effective date?
Ooh, reps. They're all going to be no.
Yeah, and here's the deal with that right now. We ask you to say yes or no on the employee represented. We do, Larry and I do not know what that data is driving. We know it doesn't drive anything as far as premiums, elections, eligibility, any of that. It's more like we were told to tell you as a BA, if you know if that employee is represented, great. You can say yes or no. It's only raw data right now, and it's not doing anything, and it does not drive the wellness incentive, any of that type of stuff that people get, or that $250 FSA thing. I'm sorry, I didn't mean the wellness incentive. I meant the CBA 250 FSA thing. It doesn't even impact that. So we don't use it for that. And effective date, yeah, I don't know. It's up to you what you want to put in there, I guess.
No. Make it
Okay.
easy.
All right. Yeah, thanks. Okay, who will get back to us on the A23 questions? It's needed for GL reconciliation process and entering adjustments. Again, send in a ticket, right? They will have to identify the answer to that. Anyone that's onboarding new employees on January 16th, I'm wondering what people are suggesting for them. Go to benefits 24/7 or still submit paper forms and have the insurance people, coordinator enter them into the system. We don't know what people are doing. We've heard it majority. I've heard people are saying they want to know the system first as a BA before they really market it from the employee side. So, but just know they still can do it if they want. 24/7 loads to Pay One, how often and when? How often, Larry, do you have any idea?
5 times a week: Monday night, Tuesday night, Wednesday night, Thursday night, Friday night, just as it does today.
Okay, perfect. And then at night, right?
Yep.
Okay. Will we get an email to forward to employees on the 16th that will contain step-by-step login for them? I do not know for sure if that's going to happen, but again, there are that you can refer them to that are in these slides, right? You might want to I sent the slides to everybody. If you want to take a picture of that slide, use it as a handout, or if you have problems, or if you have an intranet that your employees can go to, you can, it's however you want to handle that. Just wondering if there is any type of delay on information going to insurance providers, like longer time period. I don't think so, right, Lair?
Should be overnight
Same.
as it currently is.
I thought you said if BA for state agency, you use the bottom button, correct? Yes, you can use, I'm sorry, if I said it wrong, I might have. But state agencies will use the bottom login. And if you use WATEC, if your agency uses WATEC, it will recognize your state email, and you click on your email and it's going to automatically pop you right into benefits 24/7. But if you're somebody who does not use WATEC, or you don't know if you use WATEC, so if you use that bottom button in your state agency and it doesn't get you in and it kind of gives you a weird message, I would say go in through the top one, and you're going to be a BA who needs to use the SAW sign in with your work email. So we just don't know who those agencies are that can or can't use the bottom one. Apologize if this is something you can't answer. Will we get any kind of notification when our employees go in 24/7 to enter their information, or do we have to rely on our employees to notify us of their choices? Again, check the tiles as a BA, check your dependent verification, SOE, to see if people are being added or removed. And then
That
if they're
status
not
report,
adding,
right?
yes,
That's
benefits
yeah.
election status report. Yeah, you'll see it under the report tile. Little unrelated, why can't I find 2024 state share dates? Um, will we be subject to lockout days and benefits 24/7? Here's
No,
what I was told.
they're
No,
holding it.
that's all going away, right?
So what they're doing is they're holding the information for those state share days and benefits 24/7 and release them afterwards. So those lockout days are not no longer in existence.
Okay, thank you. Has there been something created to ensure an employee is not able to remove a dependent due to an NMSN verification status code? No. It's the no. It works the same.
Well,
Oh, we talked about this in
they still have to
trainings
approve it though. An employer has to approve them removing a dependent. They can't
under
just
an
remove a dependent.
SOE,
Yeah,
under an SOE. But I'm wondering if I know
special
this was
for
a
open enrollment.
question for open enrollment, yes,
Yeah,
and
open enrollment. No,
there's nothing that's going to keep them from being able to do that.
nope. Special
How
enrollment.
do
Yes.
right? How do we find out who the admin person is to submit login requests? If you do not know, please send us an HCA support ticket. Ask us to identify your security authorizer. We'll send that to you so you can work with them. Um, will there be a secondary contact at HCA for BAs to send emails to if we're still unable to assist them with login issues? We've gone through resources provided in this training and are still stumped on why they can't log in. No, not for employees. Employees do not contact us directly. You do. So if you are running into something that all those things we gave you to troubleshoot to help them do not work, please let us know. Once we find the fix, we will let you know. And if it's something that everybody needs to know, we'll certainly let everybody know through Gov Delivery. Sound changes may have to do how close you are to your microphone. Yeah, well, I feel like it's right here, but we'll see. Do we have to separately enter information in benefits 24/7? Will it go to HRMS to pay one, then to benefits 24/7? If you're an HRMS employer, your demographics information, once you enter them in HRMS, will feed over to benefits 24/7. All benefits elections then take place in 24/7. 24/7 data for benefits information, dependents, address, like that, will feed over to pay one. The only thing that feeds directly to pays 20 benefits 24/7 is HRMS or, right, Blair?
Yeah, because everything goes from
Yeah.
HRMS to pay one, and then to benefits 24/7 and 24/7 to pay one.
Okay. You mentioned there is good 24/7 info for new employees in the enrollment guides. Can you remind me how we order physical copies? Yes, from the PEBB website. At the very bottom, that blue navigation bar, there's an option for forms and publications. When you click on that, it will, right in the middle of that page, will be a blue box where it says order materials. That's where you can go in, click on PEB or employees, and then the guides will be there. You can say how many you want, then give them your mailing information, all that information. They'll send it. Can multiple changes be made to an employee's account in one day or similar to pay one where only one enrollment change can be submitted per day? There.
Yeah, you can do multiple. They'll hold, use the last one.
Great. I saw a lot. Is single sign-on available for state agencies? Yes, single sign-on is, I think, what we talked about. The bottom button, you use WATEC, click on your email that identifies, get you right in. UW employees, since we do not have to add employees as they will continue to enroll through Workday, can you confirm that we need to add employees so they have access for COBRA or retiree, or is it something that HCA sets up as administrator? No, it's my understanding your employees' information will still be coming into Pay One from Workday. It's just that your employees will not see any of their enrollment information in there, but they will have access to those two tiles for this perfect reason, right? They have to be able to do online for COBRA or retiree coverage. It's been designed that way. A23 used when we need to enter employee premium adjustment. So no JV. Normally we have to JV between agencies. If it's not available, new process to make this adjustment will not reconcile without this feature. I,
We'll have to find out. We don't
yeah,
know.
that's one that I think too that I would like somebody to send a ticket in and let somebody answer that. Do we still key default plans when an employee defaults into coverage? No, it will automatically happen. If they don't make elections or give you forms to make them for them, they will default on day 32. Will we receive a copy of these slides for our own reference? Yes, I sent them to everyone, but I see the person's name up here as anonymous. I don't know where your email is. If you did not get a copy of the slides, we will be posting the slides as well to the PEBBA training resources page. But I do know I sent a whole bunch of them. I don't really have a whole lot of time to send them individually to people. But if there are a small handful and you give me your email because you didn't get it, I'll be happy to try to do that. Will BA have to wait to see if the information updated change in benefits 24/7 in CTC link? Did that make sense?
Yeah, it's overnight.
Okay, thank you. With benefits 24/7 being new system of record, will all documents still be deleted from the system after 30 days? Is the expectation that agencies download copies per personnel files?
What documents?
Yeah, I think documents could potentially be like things that
Uh,
are uploaded
Maybe
by,
definitive verification.
right, or SOE stuff, right?
How long is
Um,
definitive verification there for? And also like proof of, you know,
SOE.
yeah.
Well, the developer had indicated, you know what? I can't say right now. I don't remember, but I do know it's going to be made for remain there for a little while, but at some point it does not stay there. So if you need things for your personnel files in hard copy format, that's your agency decides that. That is how you run your, your agency. We don't make those determinations. We don't even keep the verification documents. Once we have verified that, people or situations are verified and the documentation is no longer even needed by us, right, Larry? Unless it's a new dependent or a new situation or um, an SOE, a new
Yeah.
SOE.
We just have to find out how long they're keeping
Okay.
documents.
How long will benefits 24/7 keep history? We complete Medicare forms all the time and have to have when they were first enrolled. So it's my understanding if for your newly eligible, everything will be in there from their date of eligibility. But again, if you're doing it for somebody who might be retiring, who's been in PEB for a long time, maybe retiring in the next 5 years, and they have all this history through um, Pay One, you would have to get a hold of us to get you that history because that history will not be coming over. Okay, we're almost done. No, if there are no history screens, how do you suggest we complete NMS for dependents? Again, contact us for any information that you would need that would be held in the Pay One system. When we set up eligibility for someone, it asks BA to complete gender identity, which is information that was previously reported by the employee on enrollment change form. If we guess on gender identity, will the employee be able to change it on their end when they go through the wizard, or will they be grayed out? Okay, no, if it's done wrong and they let you know, first of all, it will be grayed out, but then they will let you know because on their page as an employee subscriber, it will say if any information on they go in to try to change it under their profile, it will say if any of this information is incorrect, please reach out to your benefits administrator. They will reach out to you. You can change it on your side. We have tested that. Normally, we key enrollment in Pay One and it feeds to HRMS. Are you saying that we should enter into HRMS first now and it will feed to benefits 24/7?
Well, you enter demographic information in HRMS, and then the employee will enter their information, and then that will feed over back to HRMS. So the initial one is enter demographic information that will feed the benefits 24/7. And then when they enter their dependents and everything else in there, then that'll feed back to HRMS.
Thank you. DSHS will not be notifying new hires of benefits 24/7 until 2/1 Neo. Okay. Okay. Concerning official system of record for benefits, we often have to refer enrollment history for Medicare. Yeah, you'll have to do, will be our official go-to. Yes, at the HCA support system, please send those requests in for that. Do we need to add support document for employees waiving their medical?
Well, not
So
initially, but if they waive medical outside of open enrollment, you'll have to get documentation proving other coverage availability or newly enrolled coverage somewhere else. So yes, but if a new employee, do not have to have support document when they want to waive medical. They do not have to do that.
thank you. Do you still need to transfer employees in and out of agencies and benefits 24/7? Yeah, in and out.
Like claim. So like you
Yeah.
transfer them out
So
and then people can
yeah,
claim them.
Right. Yes, you would still be doing transfers. And that just means, right, that there's really no break in their coverage, which means they can't, when the transferring in agency gets them, claims them, that employee would not be offered any new elections. Is there currently an electronic version of 24/7 enrollment guide? No. Well, wait a minute. Enrollment guide for the employee? No. Um, we have basically enrollment guide is kind of like your instructions when you enroll. Those are the same exact instructions pretty much when they're enrolling. But I'm not sure if you mean that or like an electronic version of the enrollment guide with the benefits 24/7 information, because there is an electronic version of that too on the PEBBA website. Will dual enrollment situations remedy themselves, or will
You
it
see,
stop a
you see
dual
the one
enrolled?
above that?
Yeah,
Christy
it
was
says
talking about the DV docs. How long the DV docs going to be there for employees, for people to be able to view until they actually take them down? So if
right.
I up,
That's the one. I don't
yeah,
have a question. I don't have the answer. I thought at one time they said 1 year, and then somebody said
we got
90
to find
days.
out. You're right.
We got to find out. Yeah. Will dual enrollment situations remedy themselves, or will it stop a dual enrolled employee from making selections online? It's my understanding the system will recognize a dual enrollment and not allow you to go any further until you figure out what they want, and it won't be automated. Is that what your understanding is, Larry?
Yeah, I guess
We have to,
yeah,
yeah, we probably need to further investigate that as well. Can we put in a ticket to remove gender identity from eligibility screen? There's no way for BA to know. Correct. We already had this submitted, and currently right now, they will not be removing it from the eligibility screen, but there is a way to correct it if you don't put the information in accurately. Will the new hires that start on 116 that are keyed in HRMS feed over to benefits 24/7, or will we need to enter them? Nope. If they're already in HRMS, they should migrate over. Those would be the ones I would check on, though, if you have just a handful. DVs required for existing employees waiving medical for both open enrollment and SOE.
yeah. For anybody, if you add them for dinner only, you need to provide dependent verification. So
Okay,
whether you do open enrollment or special enrollment, dependent verification is required.
thanks, Claire. And this is just a comment that the BA 24/7 manual was seen on the website today. And good, because I do know it's out there because I've been referring to it. So I think that we have tried to the best of our ability to field the questions that came in. We are waiting to, right, on the 16th to see how things go. And